right? So pneumothorax, right? We have some air in the collapsed lungs there, but just looking here in the hilar region, right? You notice that the hilar region doesn't look that dense, right? It doesn't look so bright. We come over here back to our pleural or pulmonary edema, and now you see that extra fluid buildup in that hilar region. So, one of the big things to pay attention to when you're going through these pathologies is, does the pathology deal with fluid or does the pathology deal with air? Right? Because a lot of times it's either going to be fluid buildup or air buildup that is our pathology. For example, atelectasis versus pneumothorax, right? Both of them sort of involve the collapse of the lung. But which one will show you a pleural space filled with air? Pneumothorax, correct. So in the pneumothorax, you expect it to look dark. Right? On atelectasis, you don't have air in those spaces, so it looks more white. Okay. Let's see if we have another example. Just something like COPD versus something like pulmonary edema. So, what is COPD? Chronic obstructive pulmonary disease. So it's difficult for the lungs to get rid of the air. So the lungs fill up with air, and how do those lungs look?
Black.
Black. Like they look radiolucent. And then you compare that to something like pulmonary edema. Instead of air, what do we have building up? Fluid. And so the lungs look more white. They look more radiodense. Very good. So when you're going through these, pay attention to if we're dealing with air or if we're dealing with fluid. If we are dealing with fluid, what often ends up happening to those exposure factors, the KVP and the mass?
Increase.
They increase, good. Right? We need more power to punch through that extra fluid. What happens if we're dealing with the buildup of air?
Decrease.
Right, those factors have to decrease because now we're shooting through more easily. We don't need as much power to shoot through the
Which
chest.
factors, KVP and?
So exposure factors include things like KVP and mass.
Make sure you guys are paying attention to the views because that will be on the test too.
Yes, that is a great point.
What about
So,
the?
like on the views it says PA and lateral chest, so you need to know which pathology goes with which types of views also.
Whether it's lateral or.
What about the
And
exposure?
the way that I remembered it is I would just gather up all the pathologies that have the same similar views, and I'd write those down, and then whenever the test came, it was easier to remember which ones go which.
Exposure
That
adjustments
is
are
a
made
great piece
for
of advice, right? Group pathologies
systems
with similar views. For example, pulmonary edema, right? We have PA and lateral chest. What about something like pneumothorax? What kind of views would you expect for a pneumothorax? PA lateral, so upright PA lateral, or now we also have DQ as one of our possible views. And what if it's something like pulmonary emboli instead?
Embolus is a clot, sir, right?
Embolus is a clot.
So then again it will be, because it will be white and spots.
Okay, so what is that, Regan? CT scans. Yes, so with pulmonary emboli. Right? We could try using PA lateral, but it's hard to see them on an X-ray. So we actually prefer using CT scans, which is why you have these images here. So pay attention to these views, especially pay attention to exams which have unique views. For example, what exam would you want to, or what pathology would you want to do apicolordotic chest X-rays on?
To remove the clavicle to see the APCs.
Good. Why do we want to remove the clavicle?
So that we can see the diseases.
Yes, but what pathology?
Oh.
That was.
Oh, because collapse of the lungs.
Jay? Did you have something, Jay? I thought I saw your hand.
I did, but then I thought better of it.
Is that better?
Why would the AP? Why would you want to see the
Any other guesses for the lordotic? Why do we do this? What could we see? What
What do
pathology?
you want to see apex from?
Mass, a tumor,
Not anymore. You
mass or a
have
tumor?
some. You have some dots here in the apices of the lungs.
a tumor.
Yes, tuberculosis. Specifically, secondary tuberculosis.
Oh, Lord.
Right? Secondary tuberculosis.
I'm so happy I'm in here. Get off.
Right, so as you can see, right, there we have it, lordotic chest.
They're in heaven.
So pay attention to those unique views if you do see them.
What are
Those
you
make
looking
good
for in
questions.
secondary tuberculosis, sir?
So you're looking for these.
There's a bilateral classifications. What do you mean by bilateral?
Oh, sorry.
Oh, classification, I see.
All right, great. So definitely pay attention to the views, pay attention to exposure adjustments, pay attention to fluid versus air. Yes, Cody.
For the fibrous adhesions, it
Yes.
says that we decrease the exposure adjustments. Do you know the reasoning for that?
Let's take a look. Fibrous adhesions, so we're talking about obstruction.
You passed
Just
it.
pass it.
Okay.
Those are the fibrous bands.
So, if we take a look at our fibrous adhesions, and we take a look at how it appears, what do we see?
Oh, air.
Oh, air-filled.
Air-filled.
Okay.
That's right.
That's what those black splotches are?
So, this here is a CT scan. This is not an X-ray, but, right? So, these areas of black are going to be areas of air. The reason why I have the CT scan here, not just an X-ray, is because the CT scan shows this adhesive band really well. Like normally you have this colon right here, and it should just look normal. It should look kind of even. But here you can see this dark band coming across it, which is showing you where it's constricting the colon. So I'm just showing you what an adhesive band would look like for the anatomy. But if this was an X-ray, you would see that the colon is going to be filled with gas, right? Kind of like with all these other obstructions, right? Just like with Crohn's disease, you can see it filled with gas. And so when you do have that air-filled colon, right, all that air is going to make the area more radiolucent. So just drop your technique a little bit.
So if you give an image, you give an image and you ask us what about it, sir, basically?
So I could give you an image and ask you to identify the pathology, but it would need to be a very, very obvious pathology. Okay. More likely, what I'm going to do is I will give you an image, and I will also give you some information about this image. So I might give you something like this and say,
What?
okay.
Oh, carpentry.
And so in this image, I may like,
Yeah, that's
I may circle the region. I may say, this area here, right, where you have an apparent constriction of the colon, is indicative of what? Right? And it might be like apple core, it might be bird beak, it might be coffee bean, and it might be something else, right? But based on the image and based on the information I give you, right, constriction of the colon, the answer should lead you to apple core.
This one,
Something
no?
like that.
I don't remember this one.
You don't remember that?
No, not the apple core. I remember the bird beak.
Oh,
The bird beak, the bean. But we never did the apple core.
really?
We're special.
I thought it was.
We're special.
I know. Oh,
Merrill
yeah.
gang.
Well, that's why I'm learning new stuff with y'all.
Okay. So that's an example of how I could approach images with the exam. Yes, Cody.
Could you explain the acute abdominal series again?
So acute abdominal series, the idea here is just to know what kind of exams fall under an acute abdominal series. So, for example, you may get an order for an X-ray, and it might just say abdomen KUB. So that is not an acute abdominal series, that's just a plain abdomen. However, the exam may say abdominal series, upright and supine. So now that tells you, okay, we're going to be doing multiple images. One of them will be an upright abdomen, one of them will be a supine abdomen. You may even get abdominal series where it says abdominal series, chest, upright and supine. So that tells you you have a chest X-ray, an upright abdomen, and a supine abdomen. And the idea here is just that some pathologies do not require the patient to be upright. All we need is the supine KUB, and we can see what we need to see. Some other things will benefit from the patient being upright. So we do one image with them up, one image with them supine. What sort of pathologies or what sort of things might we be looking for specifically in that upright abdominal X-ray?
Air, sir. Upright.
Air and fluid and levels, very good. We want to see where the air goes, we want to see where the fluid goes, we want to see the level, the line between air and the fluid. So any pathology that does deal with free air or free fluid, we would most likely see an acute abdominal series versus just a plain KUB. All right, anything else? Are we feeling okay or feeling a little bit better? So, yes.
Sorry.
please, go ahead.
Did we go over COVID and how it would be imaged in this lesson, or?
COVID. So no, we have not discussed COVID as a pathology. That is something that is interesting that we could talk about. That is something that is still actively undergoing research as well. In fact, I believe 1 or 2 years ago, one of the, do you remember me telling you about the essay competition, the scientific paper competition? For TSR? Right, I'm trying to get you the right paper.
Like $50 or something.
Yeah, you get, no, that's only third place. First place, you get 150. That's right. But yeah, one of the students that year did a paper on radiography and COVID to talk about how we use radiography to identify and diagnose COVID. But no, we're not going to be talking about COVID as far as pathology goes in this class.
Okay.
It's still a bit too new.
Okay.
Okay. Where's everyone running off to?
Getting scared?
Yeah.
You got so scared they had to go before they had an accident, I see. Well, let's see. I do have a small review here for you all.
Small.
Yes, it's small. So, I have quizzes here. Okay, so, to be honest, this is my first time using this, so hopefully we'll kind of work our way through this together. So if everyone would please go to that site listed at the top, joinmyquiz.com, and put in this game code 463468.
Bless you.
Bless you.
Thank you.
And we'll see if this has a better connection compared to Kahoot. Hopefully we don't have people connecting or disconnecting halfway through again. You want to?
Yeah.
Sure, go ahead. No, so since I don't know how well this is going to work, I'm not going to do any points because I don't want
So we'll make it fair and give
to cause
everybody a vote.
sales.
So we just go start it. We just do start a live quiz. Is this a great place now?
No, you want to go to joinmyquiz.com.
Help me.
Okay.
Where, what website is this? 'Cause I
I ain't studying.
Joinmyquiz.com.
Join.
That's it.
Quiz. Oh. Okay, what is the code?
These markers, 463, 460.
Help me. That's what I was laughing.
468.
Like, don't give space, it's like.
Pneumothorax, okay. D's. Big student here, help me. I'll try. Okay, I'm really happy for you.
You say I try.
Missing, waiting on 2 more.
Oh, Jay went, Jones.
This is from James Jones. Kim.
Yeah.
Let me see
They
what
both
He
start
knows
with
his
J.
name.
Yeah.
Mom still call me IT tech.
Yes,
Ooh.
IT, yeah, IT tech.
Our favorite IT tech.
Put that as your name. Put
Yeah.
that as your name, IT tech.
Yeah.
Who is that, IT tech? Tech support.
Oh, is it too late to change our names?
Yeah.
Ooh, he gonna be the tech support for the RT.
Hello, I've been trying to contact you about your car's extended warranty.
John, hey.
Go over there.
Should make a John so you can see.
Huh? I didn't hear you.
You're gonna be the IT tech for when you're RT.
Yeah.
Everyone's gonna come to me, John, so you can see.
Oh,
You wanna help me with something real quick? No.
literally, no.
Yes.
Excuse me, I am a technologist, not a technician.
At your departments, because that will happen.
So you were the IT person.
Yeah, I could talk.
That's annoying, because you would probably be on the other side and wait for those IT people.
Yeah, but you know, it's like,
You're
the
very
printer's not
helpful.
working, or this isn't working, or that's not working, so.
It's not letting me.
It's still not working?
Go use your laptop. What about talking
What up?
What's the code?
4 3.
I think I'll just use
No.
this one.
It's not covered.
Yeah,
It's
babe.
not covered.
Or,
It's 436 or 463.
or if you wanted to like.
John is not
464.
covered. It's a different one. JohnMyQuiz.com.
Oh,
Go to johnmyquiz.com.
yeah, dude, you're on the
What are we playing?
Johnmyquiz.com.
Alright, I couldn't tell you.
You're good.
You're good.
Thank you, Shane.
Every day.
No, I feel dumb.
Okay.
And there's no space
That's
there.
okay.
When you
Do you remember that time when,
4, 5, 6, 7.
of course.
Oh, yeah. You even started your recording, right?
Are you still trying to connect, John?
Yes.
It's already started.
How many?
Three?
Alright.
Wait, are you in?
Come on now.
What?
Emily's still not
My name starts with J2. You can't just take that from me.
You're a menace.
Where's your name now this time?
Nah, nah. We know who I am. I've been consistent. I've been consistent.
Wait, is this for extra points or something?
No.
No extra
I don't know
points.
study.
Just practice.
So, yes, just practice. This is my first time using quizzes, so I'm just seeing how well it works compared to Kahoot.
The music is
So,
Can we put the music?
You got music?
Mr. Don can do it.
Alright, well, let's see. Okay, I think we've got everyone in here. Let's go ahead and start.
Alright. Can we turn off the lights?
Which of the following involves a mechanical obstruction of the upper airway? Aspiration. Oh,
Giving us some
Oh,
information.
all right. Very good. Great job. Everyone got that?
Woo!
Very good.
Might be
Very
the only
good.
one.
So proud. It might be the only one.
All right, then.
Alright, that's
Okay, a partial collapse of the upper left lobe of the lung would be called what? Partial collapse of the upper left lobe of the lung.
Ain't no way. Ain't no way, dude. I saw the red
What's the
come
answer, sir?
wall. That's unfortunate.
Okay, so
Atelectasis.
the answer
You got it
was
right.
atelectasis.
This is what I chose, but
Stop. Bronchiectasis involves the what? Bronchiectasis involves what? We've got inflammation and widening of the bronchi. It says air buildup in the bronchioles. Fluid in the alveoli or telescoping of the bowel.
I got bronchitis.
5 seconds. Just in time.
Love to see it.
Oh, some new leaders. Okay, so yes, bronchiectasis involves inflammation and widening of the bronchi.
I got bronchitis.
So remember, it's not excess air buildup. If anything, we're gonna have mucus or pus that builds up in the bronchioles instead. Okay, remember, we're not dealing with alveoli, we're dealing with the bronchi and bronchioles, and nothing about the bowel. Thick mucus in the bronchi eventually leads to bronchitis because of what? 5 seconds.
So much more dramatic than Kahoot.
It is.
I feel like I have to answer correctly.
incorrect I got.
There's 17 people playing?
Okay.
What is the answer for this?
All right, game
But
time.
there's only 15.
Back up.
You don't think Miss Bunny is in this?
Alright,
They
so
chose
yes.
the questions.
The thick mucus causes inflammation in the walls of the bronchi. And that inflammation eventually leads to bronchitis. Right? So, fungal infections, right? Fungal infections is not bronchitis. Which one did we discuss fungal infections with? The one with the H, yes, that's right. Histoplasmosis.
I got this wrong.
That's the only fungal infection one we discussed.
Histoplasmosis is
So, itis is inflammation. Not
Okay, next up. COPD causes the lungs to appear how? Just randomized. 5 seconds.
Oh,
Close
yeah.
one. Cutting it close.
All three,
That was my other one. So it was like 50-50.
all the other three
Is
are
radio lucid?
New top 5, alright.
very dense.
So yes,
More dense is
COPD
basically
makes
same
the
thing.
lungs look
And more light.
radiolucid.
I thought I
Remember,
clicked.
earlier we said COPD traps air in the lungs. So if there's more air in the lungs, it's gonna look more radiolucent, right? It's gonna look less radiodense. It's gonna look more black. Okay. Next up. If a patient has cystic fibrosis, the doctor may order what type of X-ray? Think is now the lead. Yes, think. Okay, so cystic fibrosis. The views would be just a routine chest, just a PA and lateral chest X-rays. Remember, cystic fibrosis, we're going to be looking up here in the lungs. So we would not be doing anything. We would not be doing an abdominal series. There would be no reason to look at the abdomen. Okay. The word dyspnea means what? Think back to your medical terminology. What is dyspnea? Oh, that was fast. Okay. Oh,
No.
how much change? Okay. So yes, dyspnea, dys meaning difficulty, apnea meaning breathing. That's right, that's P-N-E-A, right? Breathing, same thing with, you also see this kind of like in pneumo, right? Like with pneumonia, dealing with the lungs. All right. Next up. Oh, what happened to my music? Okay, anyway, emphysema is considered to be a type of what? Oh, so sad without the music.
Did you click that timer button?
Oh, maybe it's the timer button.
Yeah.
No, wait, the timer said like 5 times.
Because so, where it said next question, right underneath that, that didn't have a line through it before. Now it does.
Okay, I'll double check that. All right, so yes, emphysema is considered to be a type of COPD. So, how would you expect a lung to look in a patient with emphysema? So, since it's a type of COPD, we also expect it to look black. We also expect it to be filled with air.
Could you remind us what a pneumocosis is?
Pneumoconiosis. Okay, so pneumo, lung, coniosis, dealing with dust. So this is dust in the lungs. So we have a couple examples of pneumoconiosis. For example, we have anthracosis. We have asbestosis. We have silicosis. Right? Specific types of dust that can enter the lung. Yes?
So, with that is asbestosis. Is that any which related to mesothelioma or whatever it's called?
Yes. So you might see those ads on TV that's like, if you've like had a place with like asbestos, and now you have like mesothelioma or whatever, you may be entitled to compensation. So
Is that a synonym for asbestosis? Or?
no, they are going to be different. Asbestosis may lead to something like mesothelioma,
Okay.
but they are separate.
So I'm assuming the oma meaning that the illness progressed to cancer or
Correct.
cancerous?
So mesothelioma is a type of cancer.
Okay.
All right, next question. Oh, nope, that just made the timer go away.
Looks like we don't need music after all.
Oh no.
They lost the rights to it.
Okay, the music.
Oh,
Oh, there it goes.
Oh, there it goes.
Question.
All right. we don't have a timer, but let's still try and answer this.
Wait.
Epiglottitis is most common in what type of patient? So what is it?
Kids shouldn't.
Young children.
That's right, children,
Adolescents.
right, ages 2 to 5. Very good. Alright, almost everyone.
He's like, we're not talking about this one.
Almost had a perfect one.
Probably.
Okay. Secondary tuberculosis is best seen with what type of X-ray? We just discussed it.
Yes.
Hint. Secondary
Should have
tuberculosis.
first.
Think about the EPC.
10 seconds. 5 seconds. 1 second. Oh no. Within time?
You guys
I still might have just very end. Okay. Not too much change.
Damn.
Okay, very good. So, secondary tuberculosis, just like we said earlier, you have those bilateral lung calcifications in the upper lobes. So what do? We lean the patient back, flip those clavicles up, and look at those upper lobes without superimposition. So apical lordotic. Right, next up. A pleural effusion caused by blood is known as what? Read the question. Take a look at the question. It contains information that you can use as a hint.
Could you click full question view as opposed to thank you?
Employee human thorax, cytothorax, or thorax.
It's not gonna. But I still want to see the answers like after I.
But it's not gonna. He has to click back now. You have to click X.
Oh, okay, my bad.
All right. It is hemothorax. Very good. So pleural effusion in general used to be called hydrothorax. But if we're talking about blood in particular, then hemo, right? Hemo for blood. Empyema, what is this? Good, it's pleural effusion caused by pus. Okay, so empyema is a pussy pleural effusion. Hemothorax is a bloody pleural effusion.
One more time.
Hmm? So empyema, pleural effusion caused by pus. Hemothorax, pleural effusion caused by blood.
Okay.
Okay. Pleural effusion in general is just fluid.
What's pleurisy?
Pleurisy, it's an inflammation of the pleura, the lining of the lungs.
And hydrothorax is nothing because
Hydrothorax.
So,
Hydrothorax is another name for pleural effusion. It's the old name for pleural effusion. Right? Hydrothorax isn't a great name because hydro implies it's water, but as you can see, it can be all sorts of fluid, right? Not just water.
So that was like bond triggers or something like that, or even
Well,
before that.
No, before that.
Okay.
It's old school medical terms. Okay, next up. A pneumothorax occurs when what happens? So, air accumulates in the pleural cavity, fluid accumulates in the pleural cavity. Air accumulates in the bronchi or fluid accumulates in the bronchi. Which of these best describes a pneumothorax? One second. Doom. Okay. Ooh, Mana, moving up. All right. So yes, the correct answer is air accumulating in the pleural cavity or those pleural spaces. And remember, it is air and not fluid in pneumothorax. Pneumothorax is air. If you were called to check the placement of a chest tube, what pathology did the patient most likely have?
That sucks.
So you're there, you're x-raying a chest tube. Why does the patient have that chest tube? 10 seconds. 2, 1.
Well, imagine if she still got rain.
No, I mean I yeah. That sucks.
Okay. Once again, the answer is pneumothorax. Remember, treatment for pneumothorax involves a chest tube. Putting that tube in between the ribs, release the air, let the lungs expand back to their original size. Over here, volvulus. Remember, volvulus is an abdominal pathology. So you would not be expecting an abdominal pathology to be treated with a chest tube.
And volvulus is the twisting.
Correct. Volvulus is the twisting of the colon. Okay. Next question. Fluid buildup from pulmonary edema may cause the hilar region to appear how? So we just talked about pulmonary edema at the beginning of class. We saw that hilar region. How did that hilar region show up? Meantime, almost to the 5 digits. Very good. Yes, the hilar region appeared to be more white. Right? It appeared to be more radiodense. Okay, question 15. A pulmonary emboli is best visualized with what type of imaging? What kind of picture can we get to best visualize it pulmonary emboli?
That's right, sir.
Not seeing anything. Okay, and so correct answer. Let's take a look.
CT scan.
CT scan. Yes, very good. Alright, so chest CT for pulmonary emboli. And once again, just remember, pulmonary tells you that you're dealing with lungs, so you can immediately discount any abdominal x-rays, right? Abdominal x-rays will not demonstrate the lungs. Next, hyaline membrane disease is also known as what?
Don't know.
Hyaline membrane disease.
Just one.
All right, very good. So, hyaline membrane disease, also known as infant respiratory distress syndrome, RDS. Respiratory distress syndrome. Does anyone remember what chemical it is that infants are not able to properly produce that leads to hyaline membrane disease? Surfactant. It is surfactant. Great, almost done. Few more questions. The apple core sign shows up where? Where do we see the apple core sign? Do you remember which chapter this was in? That should give you a big hint. Let's see how we did. Very good. It does show up in the colon. See, so this is something that shows up in that colorectal region. How should a patient be positioned if there is concern for pneumoperitoneum? How should a patient be positioned if there's concern for pneumoperitoneum? 5 seconds. And so, how should they be positioned?
Upright.
Upright. Very good.
Not like on their side to do the cues.
So, recumbent lateral, right? Because it does not say decubitus, you're still going to assume a vertical beam. Right? If this was lateral decubitus, then yes, that would also be correct. So upright or lateral decubitus, those are your two best options. Yes, Jay?
Among those two options, which would be the most optimal? So if the patient is ambulatory, you would opt to do the upright as opposed to the decubitus? Or?
Yes,
Okay.
I would. Upright is easier to position for. It's easier to keep the patient in position. It's more comfortable for the patient. So I would prefer to do upright when possible.
Thank you.
You're welcome. Good. So remember, pneumoperitoneum, free air in the abdomen. Anytime it's free air, we want upright or DQ. Abnormal connected openings are also known as what? What is the other name for abnormal connected openings? Remember, we talked about this in connection with Crohn's disease. Okay, so, did everyone get fistulas? Oh, let's find out. Very good, fistulas. Coffee bean sign, remember that's more ileus. Okay. Ulcerative colitis is associated with what? So ulcerative colitis, what sort of things do we connect to ulcerative colitis? One of them was the thumbprint, right, or the fingerprint sign. What else do we connect with ulcerative colitis? 5 seconds. Let's take a look. Okay. And so, the correct answer was toxic megacolon. Okay, so remember bird beak sign and coffee bean, right? Those are ileus. Toxic megacolon, right? That's going to be ulcerative colitis. Lack of surfactant, right? Which one was that?
Our respiratory
Respiratory
distress.
distress syndrome.
Right, respiratory distress syndrome in infants, right? Hyaline membrane disease. Okay, yeah, bronchograms, same thing. That's also hyaline membrane disease.
So bird beak is for what, so you said?
So bird beak and coffee bean were for ileus. Oh no, I'm sorry, volvulus. I apologize. Volvulus. Bird beak and coffee sinus. Yes. Sorry, bird beak and coffee bean was volvulus, not ilus.
And that's due to the twist.
Correct. So that's due to the twist.
Could we see, sorry, what was the toxic megacolon?
That's the megacolon, sure. So extreme dilation of the bowel. Toxic megacolon.
Where do you see the dilation, sir?
So you see how it's super wide? That's your dilation.
So bowel does not mean the place where you have the colon.
Bowel is intestines.
So is that high, sir, bowel?
Small bowel and large bowel. Okay. So, great job. Let's take a look at our final standings.
Sad day.
Okay. So congratulations, Think, Game Time, and Nana. Great job. Round of applause. Okay, so how are you feeling about the material now that